We created a new operating suite over in Meaford that allows us to do cataract surgery over there. It has some of the newest state-of-the-art equipment to let us do sort of the standard cataracts, but also do some additional things like astigmatism management in patients much more accurately than we were able to do before. It provides an extra level of service to the patients in the community. The idea is to have a setup that allows us to sort of increase the level of services that we can provide to the patients. And in part, that's having the equipment, but it's also in the future being able to recruit new physicians that can come and increase the volume of services that we can provide to the community. Our referrals are usually through either optometrists or family physicians. They get referred to us. They usually get an exam in one of the physician's offices. And then once they've been assessed for cataract surgery, then we book them through the hospital, either here in day surgery or over in Meaford in day surgery. There's some flexibility for the patients if they have a specific preference. It's really been a team effort to kind of bring it all together. There's lots of moving parts in setting up a new OR, and it does take a whole group of people to bring it to fruition.
As some folks might know, the opiate crisis really hit a peak during the COVID outbreak. In some communities, overdose deaths went up to 60%. The SOS team is a multidisciplinary, multi-agency team aimed to provide health, social, and wraparound services to folks in our community who might not otherwise have access or the ability to reach our traditional services. One of the things that makes our program really unique and points to the success is how we've been able to collaborate with so many agencies in our communities and build on their successes and resources. In the first 6 months of the initial pilot project of SOS, there was over 300 primary care visits, over 300 mental health harm reduction visits, over 1,200 unique clients, and over 3,000 units of basic care needs delivered to patients. We have a phone that we keep with us that we access phone, messages, and text. We travel where we're needed all over Grey Bruce. We bring with us whom is most appropriate, the best resources available. Very frequently, we're meeting folks in the streets, in their apartments, sometimes at other agencies, just trying to make folks feel comfortable in whatever environment works for them. Most notably, I'd say our patient outcomes are significantly improved. This is a really unique program. We're really truly meeting folks where they're at, providing them with choice and safety and trust, and also improving patient satisfaction.
One of our goals as an organization is quality care close to home. In 2021, our CEO, Gary Sims, approached support services with the idea of creating a patient transport team. The Non-Emergent Services Transport Team, or NEMT, was created, and it is the first transport team of its size within the province. Taking the transfer in-house allowed us to communicate between the diagnostic team, the clinical team, and the transportation team all in-house and ensure that it is the fastest, most effective transfer for our patients.
The non-emergent medical team helps lower our patients' anxiety. Knowing that they have a team to support them throughout their appointment process, including a trip to their home hospital, allows them to focus on their medical needs.
Palliative care in the past has sometimes taken between 36 and 48 hours. We are now able to provide that palliative care on a much faster timeline. Instead of 36 to 48 hours, we can often transfer those patients to palliative care within 1 to 3 hours. We will start to do more long-haul transfers to both Kitchener and London. We have the ability to continue to grow the program so that we can do around-the-clock transfer care.
Shortly after the COVID-19 pandemic, there was a disconnect and a lack of access to rapid access addiction medicine, or RAM, for the people of the Saugeen First Nation community. Saugeen First Nation has partnered with Grey Bruce Health Services by providing the building as an in-kind contribution. Our team is made up of a diverse group of people. They double check that all the doses are correct and we have everybody's medication. They put it into a lockbox, and then the nurse and the outreach worker go out and deliver medications to all of the clients that we have on our roster. They take snacks out with them because food security is an issue for a lot of our clients. One of our staff members is a very talented beater, so she has been teaching our clients beating.
It would be great to be able to bring what we have learned and what we're doing here to other First Nation communities as well. Where I'm from, the closest pharmacy is an hour and a half away. For them to travel in itself is one of the biggest barriers.
This program has grown from being only an outreach program to now having a permanent home at the Wellness Center, where not only they have access to RAM, but to much needed wraparound services as well. One of the biggest things is seeing the difference that we're making every day in people's lives and being able to celebrate those wins with them.
My name is Cindy Savoy, and I'm an RPN, a float nurse. A float nurse is a nurse that floats between different units and departments within the hospital. A typical day as a float nurse can be different day to day. You never really know which floor you'll end up on. You could end up on a medical floor, you could end up on a surgical floor, or some days you could even end up in the emerge.
The nursing float pool was established in April of 2022 in an effort to respond to the increase in the HHR, the Healthcare Human Resources strain.
We have a master schedule that allows us to be able to have a number of float pool nurses on each day.
It's great for GBHS because since its inception in April to about the end of September, we have covered approximately 840 shifts. It has allowed us to continue to keep our beds open instead of having to close them for short periods because we don't have the staffing.
What I like about being able to adapt to being pulled to different floors is the learning opportunity with different patients, different floors, different treatments, different diagnosis. There's a lot of opportunity to learn.